The last 15 years have seen a dramatic entry into the treatment race in myeloma with these new agents called biologic agents. So thalidomide, lenalidomide and bortezomib are biological agents. That is, they act on mechanisms in the myeloma cells and in the supporting surround tissues for myeloma cells to improve responses to other therapy and to primarily treat the myeloma. They are not chemotherapy agents, but they still have side effects that need to be thought about. Thalidomide, the oldest of these drugs and the first one to be introduced into practice in the late 1990s, early 2000s, has a number of side effects which relate to its primary indication back in the 1960s, which was of a sedative and anti-nausea agent intriguingly introduced into the management of pregnant women, where it produced disastrous consequences. But because it's a sedative, it does produce sleepiness and drowsiness, and this is dose dependent. That is, people get this in a variety of, or get this in different intensities depending on the dose used. And this needs to be titrated, that is, dose adjusted against an individual patient's effect. Along with drowsiness and sleepiness comes constipation, and this is part of the side effect profile with this drug, which can damage nerves temporarily and sometimes permanently. So the nerves in the abdomen controlling the bowel can be put to sleep, if you like, by thalidomide, causing severe constipation, and appropriate management of that is very important. The other nerves that are commonly affected by thalidomide are the nerves at the extremities, that is the hands and the feet, producing tingling and numbness, and this is a dose-dependent thing, so it occurs more frequently with more prolonged use and is usually the side effect that limits the length of exposure to thalidomide that a patient might have. Lenalidomide is a more modern variant of this drug that was introduced in particular to cut down on the risk of nerve damage, and it has done that dramatically well. It is also a more potent drug than thalidomide and probably produces deeper responses. However, it can affect the normal bone marrow function similar to the way chemotherapy does, and so the blood counts may need to be monitored more closely than it is in patients on thalidomide alone. Both of these drugs are usually used with other agents such as steroids like dexamethasone or prednisolone, or sometimes with other chemotherapy agents as well. And so the combination of these drugs with those other agents needs to be taken into account when side effects are thought about. And sometimes the other drugs produce more of the side effects that may be blamed on these new biologics. Bortezomib is the newest entry into the field of the anti-myeloma drugs. It's an injected agent and has a combination of side effects really common to the others. It can produce nerve damage as well, and this is a major problem with it when it's used late in the course of myeloma, but it also can affect blood counts and produce some what we call constitutional symptoms like fever and feeling tired. These will be addressed by an individual doctor treating an individual patient, and sometimes the dose needs to be adjusted for these side effects.